Hello everyone, today I'm going to discuss behavior therapy. But first, let's meet the pioneers of behavior therapy. We have B.F. Skinner, often called the father of behaviorism, believed that our actions are responses to environmental stimuli. He emphasized observing behaviors rather than focusing on thoughts or feelings. We also have Albert Bandura, who on the other hand introduced the idea of learning through modeling, which is watching others and learning from their actions. His social learning theory evolved into what we now call social cognitive theory. So, behavior therapy has grown over the years with four key areas of development. First, we have classical conditioning. Think of Pavlov's famous experiment wherein dogs salivates when they hear a bell. This is about learning through pairing. Then we have operant conditioning. Our behaviors are influenced by the consequences, rewards, or punishments that follow them. Then we have social learning approach. We learn by observing others and how they interact with their environment. And then lastly, we have the cognitive behavior therapy or the CBT, a modern approach of combining thoughts, feelings, and actions to bring about positive change. In this therapy, the goals are simple yet powerful. Its goal is to help clients increase their personal choices, create new conditions for learning and growth. Behavior therapists also use a model called the ABC. A stands for antecedents, which are events that happen before a behavior. B is the behavior itself, and C is the consequence or what happens after. By understanding the cycle, therapists can guide clients toward healthier behaviors. Then we have the techniques used in behavior therapy. First is the applied behavior analysis, wherein using positive and negative reinforcement or even removing reinforcements shapes our behavior. Then we have the progressive muscle relaxation, a method to relieve stress by relaxing your muscles step by step. Then we have the systematic desensitization, which is gradually facing fears in a controlled way to reduce anxiety. Then we have exposure therapy and flooding. It is the intense exposure to feared situations to help overcome them. Then we have social skills training. It is learning how to interact effectively in social situations. Then we have self-management programs. It is teaching clients how to set goals and take control of their behavior. Then we proceed to the mindfulness and acceptance. Modern behavior therapy includes mindfulness-based approaches such as the dialectical behavior therapy, wherein initially for treating borderline personality disorder, it was used for that. Then now it is widely used for emotional regulation. Then we have the mindfulness-based stress reduction. It is reducing distress by accepting the present moment. Then we have the mindfulness-based cognitive therapy. It is combining mindfulness with CBT, especially for depression. Then we have acceptance and commitment therapy. It is using mindfulness and commitment strategies to increase psychological flexibility. So, we move on to the group counseling applications. So, behavior therapy isn't limited to one-on-one sessions. In group counseling, clients learn skills like self-management, coping strategies, and thought restructuring. It's about fostering growth in a supportive environment. So, that would be all. Thank you for listening.